Welcome to University Hospital Waterford. You are here to undergo a coronary angiogram. We want to guide you through the procedure and make sure that you feel as comfortable as possible. You have been advised to have a coronary angiogram to assess for atherosclerosis in your coronary arteries. Atherosclerosis is the hardening and narrowing of your arteries due to plaque buildup. This narrowing can reduce the blood flow to your heart, which requires a steady supply of blood to work properly. This can lead to chest pain, progressive weakening of your heart, or even a heart attack. An angiogram allows us to assess the current state of your arteries. When you arrive at the hospital, you will check in at admissions at the front of the hospital. The hospital staff will ask you some questions and make sure all of your details are up to date. They will then guide you to the cardiology department, where you'll meet the nurse who will be looking after you during the procedure. Before the procedure, you will have assessment with the nurse. You will be asked about your medical history or medical conditions, any medications you are taking, or whether you have any allergies. It is important that you bring all of your tablets with you, or a list of your tablets on the day. The nurse will also perform some physical tests, like checking your blood pressure and pulse rate. An IV will be placed in your vein so that intravenous medication can be given if required. The coronary angiogram procedure will take place in a special room called the Coronary Catheterization Laboratory, or cath lab for short. This is a specialised area that is equipped with the latest technology and X-ray equipment to perform the procedure safely and efficiently. The cath lab team will include a variety of healthcare professionals, including doctors, nurses, physiologists and radiographers. They will work together to ensure that the procedure is performed safely and effectively. Your doctor will be there to perform the procedure and interpret the results of the angiogram. The nurses will be there to monitor your condition and make sure you're comfortable throughout the procedure. The physiologists and radiographers will help with the equipment and imaging during the procedure. The cath lab is a sterile environment, and everyone who enters will be required to wear special clothing to prevent infection. You will lie down flat on the table during the procedure. There will also be an X-ray camera which will be above your chest during the procedure and move around close to your body during the procedure. You will be connected to the monitoring equipment during the procedure, which allows us to continuously monitor you throughout. We will initially numb the access site, which is typically in your wrist or groin, which allows us to access your blood vessel via a plastic sheath. Many patients get additional sedation through a drip in your arm to help you feel drowsy and relaxed. However, you will not receive a general anaesthetic. We then pass wires and tubes through your blood vessels up to your heart. Through these tubes, we inject X-ray contrast into the heart arteries. This allows the arteries to be seen on X-ray. If there is an area of significant blockage, if appropriate, we can utilise inflatable balloons and stents to improve the blood flow. These are passed along the wires and inflate to dilate and bridge open the coronary arteries. This add-on procedure, called percutaneous coronary intervention. If this is required, your doctor will explain this to you in further detail and answer any questions you may have. While it is generally a safe procedure, there are some risks to be aware of. These include, but are not limited to, pain, bleeding, hematoma or bruise, damage to the blood vessel at insertion site. Rarely, this may require surgery to repair. Other risks include kidney injury from the dye injected as it washes through the kidneys, damage to the structure of the heart, including complications or damage to the coronary arteries such as perforation, dissection or arrhythmia, allergic reaction to the contrast or dye or other medications, including anaphylaxis. Severe complications are very rare. These include a heart attack, including need for emergency coronary artery bypass surgery, stroke, or death. Once the procedure is finished, the tubes are removed and a small band is placed over the insertion site to prevent bleeding. You will be asked to rest for a few hours while the band is in place. During this time, you will be monitored to make sure there are no complications. Your doctor will explain the results to you following the procedure. After the period of observation, the wristband will be removed and you will be discharged. If you have received IV sedation, You should stay with someone overnight and cannot drive or sign legal documents for 24 hours. We will ensure any required follow-up is booked for the future. I hope this video has given you an insight into the procedure which you are undertaking. We are more than happy to answer any questions that you may have after this video.